Assalamu alaikum. Mera naam Karen hai. मैं Bradford Teaching Hospital's की Chief Nurse हूँ. आज के invite के लिए शुक्रिया. मेरे उर्दू बस ये ही है. So this is me. So when I became a nurse, I didn't quickly become a nurse. I did lots of other things first. And if you'd have asked me what I wanted to do when I was 14, 15, 16, I wanted just to play hockey and be a professional field hockey player. Unfortunately, in the UK, that role doesn't exist. So I had to then look at other things. So I've been a tiler, so putting tiles in bathrooms and on floors. I've fixed false teeth. That was interesting. I've worked in cafes and I've also worked in bars. And actually, jumping around from job to job made me think, what do I really want to do? So I think back to when I was a young child growing up in Bolton, a place in the north of England, and we had a magazine called Twinkle. And in Twinkle was somebody called Nancy the nurse. And Nancy the nurse worked in the Dolly's Hospital fixing the toys with her granddad. Now, my grandfather did convince me that he was actually the grandfather in Twinkle for a while, but he wasn't. But that was the first time I thought, actually, I'd really like to be a nurse. And I'm sure there are some photographs somewhere of me around 2 or 3 years old in a nurse's uniform, pretending to administer to the sick. But I think what we need to remember about nursing, and I'm very passionate about nursing, is that I truly believe it's a calling. It's something that's in us. It's the essence of us and our being. And I'm going to tell you a little bit more about that, including a bit of history about nursing here in the UK and further afield. So I talked about inspiration and Twinkle being an inspiration, but actually the true inspiration are these two people here. So on the left is my grandma. This is her picture when she qualified as a registered nurse in 1937. And next to her is my granddad, who was in Egypt during World War II. And whilst Grandma was working in the hospitals, Grandad was away at the war. And as a young child, they used to tell me the stories. And I used to think that my grandmother, and I still do, was the most inspirational person I've ever met. So my grandma during the war, so this is World War II, worked in Middlesex, which is near London in the UK. And the hospital she was working in, she was actually a midwife by this point, and she worked in a mother and baby unit. She was the midwifery sister, so the nurse in charge. And she used to tell me stories about her time there. And one of her stories was when the air raid sirens went off during the war, because it was very near London, they used to put all the newborn babies in a cupboard, wrap them up in a cupboard, and then all of the mums and the staff would go down to the cellar to wait until the all clear sounded. Now, I do think this might be slightly flawed, because I did ask my grandma, how did you know that people were getting the correct babies back afterwards? And she looked at me, and I thought she was going to say something like, well, they had a label on or a name band. And she said, I don't suppose we did. So I would suggest that that's one of the early day failings in governance and identification of patients. The hospital where my grandmother worked actually was bombed during the day once, and the nurses that were asleep after doing the night shift sadly died that day when the bombs came down. So these are the stories I was told, and they inspired me to want to be a nurse, to want to be a better person, and to want to care and give. So this is a bit about my rise and how my career has gone, because I've been really, really lucky. So I'm predominantly a children's nurse In the UK, you can specialise in different types of nursing. And I worked in surgery and renal and did normal nursing things. I then thought, actually, I want to do a bit more because I can look after those few patients that I'm caring for, but wouldn't it be good if I could influence more and help nurses coming through as well? So at that point, I applied for my first sister post, which was my first leadership post, and that was in Children's Burns in Manchester, again in the north of England. I then did various roles, including being a matron, being a manager, actually turned my back on nursing for a couple of years and did just hospital management. But all of this stood me in good stead to be what I am today, which is a leader of nurses and a leader of services to improve the health outcomes of the city that I work in, which is Bradford. So let's go back in time a bit. People will probably recognise this iconic painting. This is Florence Nightingale. So Florence Nightingale is probably one of the first modern day nurses that we think of. And I say modern day because we can trace nursing back to ancient Greece, but actually nursing was often associated with the church or faith, and it wasn't seen as a profession on its own. It was seen as the handmaid of a doctor or a medic. And what Florence did during the Crimean War in the late 1800s was to say, this isn't good enough. We as nurses need to be better. We need to look at the evidence in front of us. We need to understand infection and we need to understand how to look after people. And she made a very important statement, which is that, you know, the first thing we should do as nurses is do the sick no harm. And that was really important back then because what Florence Nightingale saw was that people were dying from infections because nurses weren't clean. We didn't wash our hands. We didn't wash the space. So Florence was passionate, wanted to do the sick no harm, and developed one of the first schools of nursing when she came back to the UK and actually travelled internationally, taking the word of the new modern nurse out throughout the world. And I truly believe that Florence has set up nursing for where we are today, and we should offer her a lot of thanks for that. So what does the modern day nurse look like? Well, completely different from Florence's days. Back in Florence's day, nurses maybe did dressings, washed patients, mopped their brow if they had a fever, cleaned around where they were. And actually, we look at nursing now. Nurses internationally are doing so much more. We're prescribing drugs, we're ordering treatments, we're doing minor surgical procedures. But importantly, that essence of nursing is still there because that is about caring for people and caring for each other. And again, I do like my quotes, but you don't build a house without its foundations, and you can't design and build a hospital without nurses. We are a fundamental foundation stone in that institution. I would go one step further to say you cannot have a society without nurses because we know that nursing is far beyond the boundaries now of a hospital and bricks and mortar. Nurses are in people's homes, looking after people in the community. So this is a bit of sort of how nursing has evolved over the last 100 years in the UK, really. I must admit, I do quite like the old-fashioned uniforms. I think my nurses today would look very good in long dresses and hats. I'm not sure they would agree with me, though. So nursing has evolved into more of a profession because when we go back in time, the essence of what a nurse was then was somebody that selflessly gave their self to nursing and to people. And nurses weren't married. In fact, at first they weren't allowed to be married. Then they were expected to ask permission to be married. So it was very much seen as you're just a nurse and nothing else. Now, I'm a great believer, though, in a work-life balance. I think if you're happy at home, you're happy at work, and the two need to work hand in hand. A few more of these pictures. So these are going through the decades. One of my particular favourite ones is the one in the middle here, which is something that I was taught, and I'm now feeling old because I remember this, and it was called the Australian lift. And that was how in the 80s and 90s nurses were taught to move patients or lift patients, which is what we said then. And actually what's happened many years later is that all those nurses that were taught how to do this have now got bad backs and have had to retire because of chronic back pain. So we do try and learn the lessons as we move through. So as I think now of my career and what is really important in that essence of nursing for the future, it has to be around leadership. And when I talk about leadership, I talk about authenticity, but also inclusiveness. So when I look at the leaders of today, we need to be truthful in what we're saying. We need to make sure that we communicate really, really well. We have to be highly committed. So we talked about the nurses from before that couldn't get married. So I agree, work-life balance, but you have to be committed to want to be a nurse. It's a very rewarding profession, as we know. But also, you need to be inspirational, because if you're going to inspire the next generations and keep nursing current and a profession that people will want to be part of, we have to inspire the next generations to want to be a nurse. During COVID, everybody you spoke to wanted to be a nurse or wanted to be a doctor or wanted to look after people. Sadly, as a result of COVID, now people don't want to do that. In fact, some of nurses don't want to be nurses anymore, but we need to make sure that we continue to inspire and remind people of the difference we can make. So here at Bradford Teaching Hospitals, in my role as chief nurse, we have about 2,500 nurses, and they range from healthcare support workers right up to myself as the chief nurse. And they have many, many roles, diverse roles. So we have nurses, we have midwives, we have research nurses, so nurses who are dedicated to research. We have nurses that lead on risk and governance and safety. We have nurses that look at medications, how best to give medications. And we have nurses that go into education and teach and inspire the new nurses that are coming through. And to make this happen, in my organisation, we developed a nursing and midwifery strategy. But that was really hard to bring to life. So as part of that, we developed our Bradford model of nursing and midwifery care. So there is a definition in England and a difference. So in lots of countries, nurses deliver babies. In the UK, there's a definite definition and two separate professions of nursing and one of midwifery. Often people are nurses first and then become midwives, but we now also have direct entry to both professions. So what we wanted to do was to say, actually, and this is our little moniker here for it, that we want to grow and develop our staff and really embrace the difference that our staff bring. I've not talked much about Bradford, but Bradford is a city of about 500,000 people. It is one of the most diverse cities in the UK and one of the youngest cities in Europe. And with that, that brings challenges and opportunities. So half of the babies born in Bradford, and there's about 5,000 to 6,000 a year, are from Pakistan originally, or the roots are back in Pakistan. So over half of our babies are born usually with the Muslim faith. Now that brings with it challenges but also opportunities, because we need to ensure that our staff are both representative of our population, but also understand our population and their different needs. And that to me is about true leadership. It's about valuing diversity, including everyone, and making sure that we can deliver services to the right level that we need to going forwards. So we developed a really simple model. This is the diagram of it. And I'm speaking to every one of you here listening now, because if anybody wants to come over and have a look or come and work with us, please, feel free, get in touch. But before that, you have to pass some very specific tests. So recruitment. So when we are recruiting nurses and midwives, we want to make sure that we are recruiting people with the right values and behaviours. We want people that care, that are kind, that are dedicated, committed, and want to make a difference to our population. If you get through the door, and remember we're quite picky because we want, and the people of Bradford deserve, a workforce that can help them appropriately, we then will guarantee you an induction package in education that can take you right up to a PhD if you wish. You can be developed as far as you want. And again, this is really important because what we need to make sure is that everybody working here in Bradford gets the same opportunities to develop if they want to. And then if we move on to recognition. So the other thing that we like to do is we like to celebrate in Bradford. So if you are doing a really good job, I'm going to tell you, the public's going to tell you, and we're going to celebrate that, and we're going to embrace that, and we're going to say, look at that person there. They embody what a nurse should be. They're kind, they're compassionate, and they've given excellent care. We have something called Daisy Awards in Bradford. This wasn't something thought up in Bradford. It originated in America, and it's an international programme where members of the public or patients can nominate nurses for their exemplary practice. And we award one Daisy Award every month. And it is sometimes just a good check and balance to see the difference that all of us are making, but actually for those individuals to be recognised and rewarded, it means that they feel happier, more comfortable in work, and it boosts overall morale. And that's going back to that inspirational bit of being a leader. So what are the other key things that we need to do as nursing leaders? Well, it's really tough, this job. Every day is different. Every day being a nurse is different. You can't write one book or one manual to tell you how to do it. It's not like assembling flat pack furniture. So what we need to do is we need to keep calm. I say and eat the elephant. So there is a saying in England, which is, how do you eat an elephant? And the answer is in very small chunks. Because you cannot tackle big problems all at once. And to expect people to do that is unrealistic, and you will set people up to fail, you will switch people off, and they will become disinterested. But actually, what we also learn is that there's something about facing our fears. So some things are really daunting. So when I think of the first news reports coming from Italy about COVID back in 2020, it was terrifying. I was really scared, and I thought, what on earth am I going to do? And then I realised, actually, Karen, it's okay to be scared, but you actually need to go out there and lead with that authenticity and support staff and really allow nurses to outshine themselves and do the best job that they possibly can. We never stop learning, because I refer to that picture there, which is, the more I know, the more I realise that I didn't know. The day I stop learning will be the day I retire, because if I've nothing left to learn, then my passion mustn't be there anymore. finally, probably the most important thing around nursing leadership and nursing development is listening. We really need to listen and hear what people are saying to us. We can all sit there and say, oh yeah, thanks for that. But actually we need to understand and actively listen and understand where that other person is coming from. Walk a mile in their shoes. Why did they feel like that? Why is a patient nervous to come into hospital? Is it because they've got a past fear? How can we help to relieve that? So that active listening is crucial. So I don't know who said this, but it always makes me smile. So save one life, you're a hero. Save 100 lives and you're a nurse. I think there's probably another line under that says save 1,000 lives and you're a nurse leader, because you've inspired that so much more people. And, let's remember, dream big. Anything is possible. Think back to Florence Nightingale in the late 1800s with her lamp, giving care to soldiers with wounds, and actually thinking, this isn't right. We can change this. We can do this better. We can be better nurses. So Florence came away from that and actually opened a school of nursing and continued to teach and influence nursing to this day, really. So to this day, we still refer to Florence and the innovator that she was. So in the UK, we have something called the National Health Service. The National Health Service was formed in the late 40s, and it was formed on the principle that anybody can access healthcare or treatment from cradle to grave, and that it will be free at the point of care. And that is still the system today. And that means that if you turn up at your GP's, at your A&E, you will get seen, you will not be charged for that, and you will then get access to further treatment. This enabled a lot of inequalities to be ironed out, and is an institution that I'm incredibly proud of. But this picture here, for me, says it all. So I will end where I started. So this is Grandma Dawber, the nurse that was at North Middlesex, and the midwife. And this is Grandma Dawber when she was 94 years old. And this is her great-grandson, who at this time was 2 days old. And this really says to me, nursing, the NHS, is about, from cradle to grave, encompassing everyone and making sure that people like my nephew Harry here can live to be 94, like Grandma Dawber here. So thank you once again for inviting me to speak here today. I hope what you've seen and heard has been entertaining and informative. And if anybody's got any questions around nursing in the UK, or nursing leadership, please do feel free to get in touch.